Welcome everyone to the latest in the series of Anthropology Communicates webinars, which are hosted by the RAI and organised by the RAI's Anthropology of Policy and Practice Committee. The Policy and Practice Committee was established in 2017 as a platform to improve links between anthropologists, policymakers and practitioners. Members of the committee straddle academia and applied work, but they're united in being anthropologists who are passionate about anthropology's ability to communicate both understanding and improving the world which we all inhabit. Which brings us to the Anthropology Communicates seminar series, which we saw as an opportunity to highlight the unique perspectives that anthropology provides, and therefore to increase the potential influence of the discipline, but also to encourage anthropologists to engage with different audiences and in different settings and different contexts, and by doing so to bring about positive social impact. Today's webinar, Anthropology Communicates on International Humanitarian Action, will be chaired by John Borton, who was a founder member of the Policy and Practice Committee. John's worked for over 40 years in the humanitarian sector in research, evaluation, learning and capacity development roles. During his 11 years at the Overseas Development Institute, he led the Study 3 team of the Joint Evaluation of Emergency Assistance to Rwanda, and that led to the establishment of what is now the Humanitarian Practice Network, the Humanitarian Policy Group, HPG, and the Active Learning Network for Accountability and Performance in Humanitarian Action. He continues as a Senior Research Associate at HPG, and as an honorary lecturer at the Humanitarian and Conflict Response Institute at the University of Manchester. He's also heavily involved as a volunteer and trustee of a charity supporting refugees and asylum seekers in Hertfordshire. So I'm really happy we've been able to organise this webinar today, John, and I'll now hand over to you. Thank you.
Thank you so much, Richard. Yes, it's an honour to be chairing this session with such great presenters. So my role is to introduce each panellist. Each panellist will speak for about 15 minutes. We'll then open up for questions and answers, and that session will run for about 45 minutes. And then I'll ask Raymond Abthorpe to sum up the discussion and issues that have come up, and then allow the two panelists to make their final remarks. So the webinar will end about 12 noon UK time. So I look forward to almost the next 2 hours with you all. As Richard indicated, evaluation and learning have been key themes in my career in the humanitarian sector. And to some extent, I could say that I've been both a user of anthropology, a believer in it, in its use, and at times an advocate for its greater use within the sector. Just looking back on my career, I remember back in the 1980s when we were introducing evaluation of what were then called relief programs. And it wasn't a standard requirement then that evaluations interview what were then called beneficiaries or members of the affected population. Incredible as it seems, but that was how it was in the early 80s. So the evaluations that included beneficiary surveys and allowed time to interview affected members of the affected population were unusual. They were pioneering. Happily, that changed. Then moving forward, when I was team leader of the study 3 of the big Rwanda evaluation, the joint evaluation, we deliberately included in our team 2 very able anthropologists who to capture the views of the affected population as to how different agencies had performed. At least that's what I was expecting their role to be. But as it turned out, many within the affected population didn't distinguish between different agencies. despite all the logos and branding. They referred to them collectively as Croix Rouge, so the Red Cross. This collective term, there was no differentiation between CARE, Oxfam, Save the Children. They were just all generically called the Red Cross. So that sort of revealed, and of course, so the anthropologists weren't able to comment on, from the view of the affected population, how different agencies had performed. It wasn't possible to identify the agencies. So yeah, that really reflected my naivety and lack of understanding, I think, in that I had that expectation of the anthropologists and what they could provide. They provided fascinating insights into the power structures and the social structures within the huge refugee camps around Goma and Bukavu. But that wasn't a lot of use to us in the evaluation at that point for our particular evaluation. And then at times, Raymond and I have tried to encourage reflection on the role of anthropologists, but it hasn't led on to specific initiatives in the sector. And I do wonder whether, we still don't really know where anthropologists are working and what they are doing within the sector. We know of, in fact, preparing for this meeting, we were informed of a significant body of forensic anthropologists in ICRC, which I wasn't aware of. But yes, just this idea of where are anthropologists working? Where are they working? What are they actually doing? Would it be helpful if there was a network created for, or to encourage networking between anthropologists that are working in the humanitarian sector? Anyhow, I'll leave those thoughts, and perhaps we might return to them during the Q&A session. When I was preparing for this, I came across a quote by Melissa that I fully agree with. And she wrote, "Anthropological research is essential. There is a tendency in the humanitarian world to have top-down interventions which too hastily set aside the social, political, and cultural context and mistakenly encourage a one-size-fits-all approach. Anthropologists need to reverse this trend and to have a central role in what she was writing about, global health policy and practice." But I think that same sentiment could be applied to many other aspects of the humanitarian sector. So, right, now to move on to the panelists. So Melissa will speak first. Yes, it's a privilege to introduce Melissa Parker. She's Professor of Medical Anthropology at the London School of Hygiene and Tropical Medicine. During 2014 and 2015, she carried out anthropological research in countries in the establishment of the Ebola response Anthropology Platform with colleagues from Sierra Leone and the UK. And she's carried out anthropological research in many other countries in Africa and the UK on a wide range of global health issues. So it's my pleasure to introduce and hand over to Melissa Parker. Thank you.
Thank you very much, John. It's a huge pleasure to be here today. I'm just going to share my screen if I can. So it's great to be able to take a moment to reflect on how anthropologists and other social scientists have contributed to efforts to contain and treat Ebola during the 2014-2016 Ebola outbreak in West Africa, but also to think about the different ways in which they're working with humanitarian agencies on other epidemics and other humanitarian issues. So I'm going to start by saying a little bit about the Ebola Response Anthropology Platform, and then say a little about the work of the Social Science in Humanitarian Action Platform, which emerged in the wake of the Ebola platform. So to start with the Ebola Response Anthropology Platform. Like so many good things, the platform began by chance. I attended an African Studies conference at Sussex University in September 2014, along with a number of other anthropologists, including Anne Kelly, Melissa Leach, and James Fairhead. At the time, Ebola was spreading quickly across the region, with CDC modelling suggesting that in the worst case scenario, there would be 1.4 million cases of Ebola in West Africa alone by mid-January 2015. Of course, there turned out to be nothing like that number of cases. But these terrifying predictions, in combination with pleas for assistance by leaders in global health and staff employed by INGOs such as MSF, underpinned a UN Security Council resolution which stated that the unprecedented extent of the Ebola outbreak in Africa constitutes a threat to international peace and security. And it was against this alarming backdrop, as well as countless distressing images emerging in the media, that James Fairhead organised the special session on the Ebola outbreak in West Africa. Unsurprisingly, perhaps, researchers talking at the session confirm the fear, panic, uncertainty, and distress affecting people living in Sierra Leone, Liberia, and Guinea. At the end of the session, Anne, Melissa Leach, and I went to have a drink together. We wondered what on earth we could do to contribute in a helpful way. It was clear that there was no time to do research and carefully consider all the options. But it was also clear that complex socio-political dynamics were likely to profoundly affect both the delivery and response to the humanitarian assistance on offer. And we felt that it would be helpful to draw on ethnographic research that had been carried out over decades across West Africa, and to think about how insights embedded in this literature might usefully inform the response. We also thought that it would be helpful to think comparatively and to draw on anthropological research that had been carried out in other parts of Africa on Ebola, notably the 2000-2001 outbreak in Gulu in northern Uganda. Creating a platform seemed a productive way to proceed. A 2-page proposal was put together and tabled for discussion at the Wellcome Trust a few days later. They came back to us straight away and advised us to submit a full proposal to a scheme funded by DFID, ELRA, and the Wellcome Trust entitled Research for Health in Humanitarian Crises. The platform was funded within weeks. So why, you may ask, were the Wellcome Trust, DFID, and ELRA so keen to act so quickly? Well, conventional approaches to containing the spread of Ebola in West Africa were failing. Public health teams were being met with fear, and efforts to treat patients and curtail population movement were often backfiring. Both governments and international agencies recognized that anthropological expertise was essential if locally acceptable community-based interventions to interrupt transmission were to be designed. In the UK, it's also noteworthy that key figures involved in the humanitarian response, such as Peter Piot, Chris Whitty, and Jeremy Farrar, had worked on HIV/AIDS in the 1980s, 1990s, and early 2000s. And they knew only too well that socio-political dynamics on the ground were likely to shape responses to humanitarian assistance. They were then very open about the idea of finding new ways to work with anthropologists. So what did the Ebola Response Anthropology Platform actually do? First off, we established an electronic platform. It was designed with responders in mind. In other words, core pillars of the national response in Sierra Leone in particular, but it was mirrored in other parts of West Africa too, were mirrored on the platform with tabs on community engagement, disease surveillance, case management, and so on. Relevant social research was then uploaded under the different tabs. We also did our best to bring together local and internationally based anthropologists with a view to providing a coordinated and rapid response to the outbreak in real time. Of course, the UK-based platform arose in the context of several other anthropological endeavours in Europe and the USA. Notably, the AAA's Emergency Ebola Anthropology Initiative, which was run by Sharon Abramovich, a French-speaking platform that I'm ashamed to say I dare not try and pronounce, a network initiated by medical anthropologists in Amsterdam and Antwerp, who organised a meeting in Holland in October 2014, and a number of anthropologists making contributions to NGOs and UN agencies. Thankfully, there was a strong sense of collaboration and a desire to avoid duplication among us all. And it was in this spirit the roles and functions of these different groups developed alongside each other. It was agreed, for example, that the AAA's Ebola Anthropology Initiative would maintain a listserv and discussion groups for communication between anthropologists and interested policy partners, while the Ebola Response Anthropology Platform's website would act as a repository for relevant written briefings and articles. Momentum gathered quickly, and it often felt as if we were pushing at an open door when it came to discussing issues pertinent to the design and implementation of programs seeking to halt Ebola transmission. Indeed, the entire steering committee of the platform were co-opted onto the first anthropology and social science subgroup for the UK government scientific advisory group for emergencies. The subgroup was chaired by Chris Whitty and I, and it usefully established a formal relationship between the platform and the UK government. In addition, we developed close working relationships with two anthropologists working for the UK Ministry of Defence, and they helped to facilitate meetings between colleagues on the platform and officials preparing for deployment to Freetown in Sierra Leone. Discussions were always lively. So what did the Ebola Response Anthropology Platform achieve? Although we were influential in some spheres, we were much less influential in others. So let me give you a few examples. On the upside, colleagues contributing to the platform were hugely helpful in discussions about burial practices. As some of you will know, burials were typically framed by response personnel as super spreader events, with concerns over the role of secret societies and so-called traditional practitioners. At a global level, there was a strong focus on the culture of burials, including, for example, the practice of kissing corpses. And at a national level, the response was often punitive. In Sierra Leone, for example, fines and laws were put in place to prohibit traditional burials, although it was not that clear what aspects of burial were particularly likely to spread Ebola. Our discussions with DFID and WHO emphasised that in the majority of cases, practices involved in preparing a body for a funeral involved more risk than attending a funeral. We also pointed out that there were a number of precedents for adapting burial practices, most notably where a body is not recoverable or during the Civil War when large ceremonies were not possible. In other words, changing burial protocols was not necessarily problematic. It all depended on how the changes were introduced and who was authorising the changes. Such discussions usefully fed into the WHO's guidelines for safe and dignified burials, and to a lesser degree, national guidelines about how best to select people to be members of burial teams. The second area, where we were less successful, concerns home-based care. Large numbers of people suffering from Ebola in Sierra Leone were being cared for at home by relatives or friends without external support. While we certainly agreed with the UK and the Sierra Leonean governments that this situation was worrying, we disagreed about what should be done about it. the UK government were keen to focus their energies on bolstering access to small-scale community care centres, with a view to these centres complementing the work of the Ebola treatment centres. This is a community care centre. They did not approve of the idea of home care, and there were two objections. First, home care was by definition inferior. Appropriate resources could not be made available to provide the relevant training, medicines, and equipment that affected households would need to reduce transmission. Second, supporting home care might dissuade people from seeking formal care. But for us, this was missing the point. People were going to care for each other at home, whether the government or WHO sanctioned it or not. The salient comparison then was not between home care and the care provided at an Ebola treatment centre or a community care centre, but between supported and unsupported home care. Examples from previous outbreaks of people reducing the risks of transmission through home-based care had already been documented by the Hewlett's research in Uganda. And as it turned out, it was subsequently reported in Sierra Leone too. This picture shows how villagers made their own PPE when Ebola hit their village, using kind of local resources. So the picture of the man on your left is wearing a kind of rice sack and plastic bags to cover his hand, and a balaclava that would otherwise be used on the back of a motorcycle. All actually really quite impressive response to trying to deal with the situation. And they did all of this under the radar of the paramount chief in a desperate bid to avoid seeking care at the nearby Ebola treatment centre. So recommendations by contributors to the Ebola platform were very influential in some domains and less influential in others. Nevertheless, I think it fair to say that the Ebola Response Anthropology Platform demonstrated how helpful it would be to draw on insights emerging from long-term ethnographic research in West Africa and comparative work on Ebola outbreaks elsewhere to inform national and humanitarian responses in real time. Now, this way of working has continued and profoundly shapes the work of a slightly different platform, the Social Science in Humanitarian Action Platform, otherwise referred to as SHAP. SHAP was initially funded by UNICEF and subsequently received funds from the Wellcome Trust and then the Wellcome Trust in combination with what is now the FCDO. It currently involves a three-way partnership between IDS, Anthropologica, and the London School of Hygiene and Tropical Medicine. Our overall goal is to ensure that anthropological and other relevant social science expertise is mobilised quickly to provide appropriate support in real time as a health emergency or other humanitarian crisis unfolds. Particular emphasis is given to foregrounding the needs of the most vulnerable, and working closely with international, national, and local partners, SHAP activities include the following. We produce evidence on demand during crises. This involves writing briefs, facilitating roundtable discussions, synthesizing historical, economic, socio-political information in such a way that responders might be able to develop more locally acceptable community-based interventions. For example, briefs were written during the 2018-2020 Ebola outbreaks in DRC, and these informed discussions at UK DFID, but also the work of NGOs working in Ituri and Kivu provinces. Similarly, within a couple of weeks of an Ebola outbreak being declared in Guinea in 2021, SHAP convened an expert group, produced a written brief, and provided verbal briefings to response agencies. And then, of course, as you can see, we don't just work on Ebola, but we've been involved in all sorts of other so-called crises, plague in Madagascar, food security issues in Syria, and most recently, a lot of our work has been on COVID-19. In addition to these briefings, we run a fellowship program Each programme runs for 13 weeks and combines taught sessions with moderated online peer learning workshops. And these programmes link anthropologists and other social scientists with humanitarian practitioners and policymakers in the same country, with a view to developing ways to ensure their day-to-day work is informed by available social science research. There's a host of other activities that run alongside these two, including social science in action workshops, short courses, and our most recent sort of endeavour is to try and establish regional hubs for rapid research on local priority issues. So with a new round of funding that's just been secured, we're hoping to establish hubs, the two hubs, one in Uganda in July 2022, and the second hub in West Africa in January 2023. And these hubs will enable a more decentralized and localized approach to knowledge production. The Uganda hub will be led by colleagues at Makerere University and Gulu University, with inputs from SHAP members, including myself, that have carried out long-term fieldwork in Uganda and its borderlands. We'll draw on the exceptionally rich and extensive body of social research carried out over decades to help shape the development of locally led solutions to what are often complex health and humanitarian issues. So I think I've brought you pretty much up to speed with where we've got to, and I'm going to hand back to John. Thank you.
Thank you so much, Melissa. That was really interesting. I'm sure there'll be lots of questions about your experience and about SHAP. So yes, it's now my pleasure to introduce Beverly Stringer. So Beverly is Deputy Head of MSF's Manson Unit. Now the Manson Unit is a multidisciplinary medical team that supports and enables MSF field project and drives improvements in public health policy and practice. Before that, she set up the social science support for the operational centre in Amsterdam. Beverly is going to be drawing on the book that she co-edited with Jean-François Verin and Doris Bircher, titled MSF and Humanitarian Situations, an Anthropological Exploration, which was published in 2020. And this is the book that some of you may recognise. So over to you, Beverly.
Thanks, John, and thanks to the Royal Anthropological Institute for inviting me today. I'm going to spend the next 10 minutes or so describing how social science and anthropology was established in Médecins Sans Frontières. Across MSF, there are anthropologists that have been key in this. Doris Bircher and Jean-François Verin, who you've already mentioned, but also Umberto Bellescia, Mitra Asfari, and Emily Venables, to name but a few. Jean and Doris, I hope, are with us today in the audience. I will draw on elements described in a book, as mentioned, published in 2020. It describes some theoretical underpinnings to the notion of insider anthropologist and how the biomedical teams in MSF shifted from intermittent presence of anthropology to a normalized one. I'll reference it here and there, but to start with, I want to talk about what happened in its Dutch section. How, with others, Daryl Stelmack, Nell Gray, and Vanya Kovacic, we have today, in more than 15 different projects and humanitarian settings, integrated the discipline. We use analytical and methodological tools to modify the biomedical responses and to reveal the social and political differences real for people in places where crisis and uncertainty happens. Right now, I'm in Uzbekistan, following up work with people that participated in a TB trial to test a new treatment regimen for resistant TB, which has been found biomedically to be both safe and more effective than the standard regimen, and therefore will replace it. I'm listening to participants in the trial speak about their experiences and perspectives, giving important insights into care, treatment, and healing that will have far-reaching impact beyond a drug interacting with the body to cure a disease. Across the border in Tajikistan, domestic violence assumed to be a consequence of TB is, through application of anthropological methods, able to translate as more likely a driver of the disease. Both these settings and projects will develop models of care that are socio-medical, if you like, focusing on a family-centered understanding of well-being, health, and security relevant to the social contexts and differences therein. Anthropological understandings on public health have been significant with regards to reproductive health for women in Somalia and Sierra Leone, to primary healthcare approaches for people living with violence in Congo and Malaysia. So how was this made possible, and what are the shortcomings, if any? Médecins Sans Frontières, for those that are unfamiliar with the organisation, has been described as the quintessential model for medical humanitarianism. It follows an interventionist agenda based on the founders Bernard Kouchner's notion of the right to interfere or intervene, suggestive that in an emergency, medicine trumps politics. Humanitarian medicine, or medical humanitarianism, refers more specifically to the provision of biomedical care, mainly through programs run by physicians, nurses, lab technicians, paramedics, and psychiatrists. The provision of biomedical care has been integral to humanitarianism since its origins. So what of anthropology within an organisation that relies on guidelines, techniques, and protocols to perform medical responses in emergencies? What kind of dialogue do we have with medical counterparts on the subtleties of the social construction of illness, or why ideas like embodying in one person the title of community focal point would be problematic among a Rohingya migrant population dealing with structural violence in Penang? In practice, initially, we worked with our public health colleagues on their terms. We knew that we were assimilated to health promotion and community engagement, and that qualitative methods and techniques were accessible enough to provide a backdoor in. Through this, we demonstrated that the interface between critique and operational cooperation is the exact point to situate our work. With initial influence established for people living with tuberculosis, the 2015 Ebola epidemic presented an even more dramatic call, as Melissa has said already. Immediate for MSF was to set up hospital care. Understanding Ebola as it enters the home, a family, a community was absent. What followed was interdisciplinary work with epidemiologists, we later called the Anthro-Epi tandem, and method shops, which re-established expectations, explanations, and dialogue, opening the front door to critique and resetting the misconceptions about what anthropology is good for. Just briefly, for disease outbreaks, this has resulted in community-led approaches to public health measures adapted to compassionate, humanistic controls. So to the present day, now we have 3 full-time anthropologists with a transnational pool of field anthros working with those from inside Central African Republic, Congo, and Myanmar. What being inside consistently reveals is what is referred to in the book, and I quote, as when technological, logistical, and operational factors are joined with economic, political, and cultural ones. Between the first series and the second, there is a hiatus though. Something does not work. The human has not been properly factored in. Manifestly, something has escaped strategic planning. Human factors are seen as the culprit. By bringing back the social, cultural, and political complexity, anthropology shows that a suffering body is more than mere life. Humanitarian situations where anthropologists are useful are the ones where this demonstration is needed. I'll leave it there. Thank you.
Thank you, Beverly. Where the human has not been properly factored in. I think that'll fascinating. Thank you. Right, now I'm going to open up for questions from you all. So you can post the questions or raise your hand. And are there any aspects that you'd like clarification on, or you'd like to pursue further? If there's no immediate questions, then I'll just add a bit more to Melissa's presentation on SHAP, because we have in the webinar participants, we have Olivia Tulloch, the CEO at Anthropologica, who can speak a bit more about SHAP, the Social Science and Humanitarian Action Platform. So Olivia, are you there? And
I'm here.
do you have
Morning. Hi.
Morning, thank you. Could you speak a bit more about SHAP?
Happy to. Yes, of course. So something that I just wanted to cover briefly when it comes to SHAP. And so Melissa's talked to us this morning about this evolution of how we got from the Ebola platform to where we are now with SHAP, which is a sort of slightly broader and I suppose now a bit more ambitious undertaking. And I think one of the things that I think is pertinent here is that here we are at the end of COVID, and well, not at the end, but having gone through 2 years of COVID, and we're in a different phase of it. And that has been a very major undertaking for SHAP in terms of some of the work streams that we deliver. And so I wanted to mention how we manage this on-demand nature of the work that we do that Melissa mentioned. So given that our last grant started at the start of 2020, and that was just when COVID was emerging, but prior to that, we as a platform had responded to lots of requests that came in, but on quite a small scale relating to disease outbreaks as they emerged in specific settings. So for example, the Ebola outbreak, some of which Melissa mentioned, or we'd get requests from large agencies about how to develop tools or training materials about the application of social sciences. But then as COVID started emerging as this public health emergency of international concern, our work became almost totally concentrated on COVID, from convening roundtables of experts across different disciplines, but primarily the social sciences and anthropology. But also we were writing briefing papers on social, cultural and behavioural matters, and on really diverse things such as considerations about quarantine measures, or considerations on how you support bereaved people when you're in the middle of a lockdown, from how you manage COVID-19 in prisons, and also things like secondary impacts of COVID-19 lockdowns in lower income countries. And as anthropologists, this was a really big shift from something that had been really local to something that now was problematic, because it was a pandemic and it was increasingly difficult to provide really contextually relevant evidence to specific settings. So requests would come in from big agencies who we had strong connections with, but we just realized that we needed to be more systematic about how we chose what we did. So we did a couple of things, one of which was, okay, if a request comes in for us to do something, let's just assess how important it is that we spend our time on researching or investigating that issue. So we would ask, what will this briefing paper contribute to? Why is it important? Who needs the evidence? What will they do with that evidence? And we would assess it. But then something else that we did, which was really something that happened sort of during the second year of COVID, was to respond to requests for building applied social science skills, and to deliver these in places where in different locations people could use those skills. So that became a priority for us, because it wasn't us saying this is important in place X. It's if we work with individuals from a given setting and help build their skills in broadly social sciences, but particularly some anthropological and rapid anthropological methods, then that would mean that they could then take up those skills and respond themselves rather than us providing the evidence for them. So that's just a couple of the things that we've been doing, and I think that this idea of doing applied workshops has been really powerful for us, because we were getting lots of requests of like, can you help us do what you do? And so it's really been beneficial to work with partners, with ministries of health, to say this is an approach that you can take to understand this problem, and then that can become embedded in that place. Anyway, enough of that. That's some of how we're doing some of the more applied stuff now in SHAP. Thank you.
Great. Thank you, Olivia. I mean, that's interesting, the different approach. You know, Beverly was talking about building capacity internally, and SHAP offers that capacity externally to agencies, and agencies come to you to engage that approach and those skills. I mean, just returning to Beverly, I just wonder if we can get a discussion going as to those different perspectives, because I'm sure amongst the audience, you know, we've got members who are in both, or in one and wondering how to access the other. Just to go back to you, Beverly, I mean, it sounds as though it took a long period for the organization to really accept and appreciate, maybe I'm hearing this, or I'm imagining this wrongly, but it took some years to build that capacity that you've created within MSF. And were there particular stages that you went through? Particular, I don't know, differences of view or periods of resistance to the greater use of anthropological knowledge?
Yeah, there are stages, definitely. I mentioned the sort of network of other people involved, including John and Doris, who are online as well. I think when I mentioned the back door and I mentioned the front door, I mean that metaphorically that's quite significant, because you know, humanitarian biomedicine, they understand technical ways of doing things and they protocolize, and so the idea of qualitative research was quite appealing, especially when they realized that some of their numbers they could sort of elaborate on or make sense of if there was exploration around those results. But I think the group of us always knew that we were going to come in through the front door, because the limitations, I think, that we saw as far as the people involved in the healthcare that was on offer for MSF sort of were being partially supported, you know, and the blind spots that come up when you tend to sort of technocratize an approach. When I talk about the TB trial, which is a huge success for MSF, it's very clear, talking to patients that are involved in the trial, there are elements around their experience of treatment that that show that the cure laboratory result of cure isn't necessarily the end of how they approach their own healing, and the fact that they may still be symptomatic, or they've got other aspects of their lives that, you know, that there's a lot of uncertainty around that cure being permanent. So all of those contributions to us understanding how to manage the care and treatment approach that will come as a result of this trial, that whole picture is essential. And I think the anthropologists within MSF know that for many, many things. So the sort of potential for critique and the potential to help communicate across all parts of health and well-being has been an important point of success, I think. And that's been recognised. We also ran anthropology workshops where we discussed a lot of things. That was mainly with both with anthropologists and people from the medical faculty and I say faculty, but the doctors and nurses that make up the organisation, and also operations. And we talked about lots of things. We talked about how knowledge is produced in MSF. We've talked about recently, I mean, when I was sharing the journey of setup with you, I didn't mention how we are also influencing something that a part of humanitarianism that would have been the domain of anthropology of humanitarianism. That wasn't the way that we saw anthropology working inside MSF as insider anthropologists. When I talked about the theory underpinning what we're doing, it's discussed at length in the book. But recently, we've been involved in a para-analysis of the humanitarian endeavour. And when you mention with Shat that you're drawing on other networks, we do draw on other networks. We're not just working inside. We are working with other disciplines actually within the social science spectrum, and trying to look at, power beyond what the organisation is doing, which is what many organisations are doing at the moment, linked to agendas around diversity and inclusion and equity. We decided to prompt an analysis looking at the power is everywhere and looking at the layers and currencies of power. That would have been unheard of, I think, 5 or 6 years ago, but that's happening now. I don't know, JF, if you're on, if you want to add to what I've said about the journey.
Hello, everybody. So I'm Jean-François Véran, co-edited the book with Beverly. And I'm also a professor at the University of Rio de Janeiro, Federal University in Brazil. I'm an anthropologist. This is for the presentation. Yeah, in terms of the question that was raised by John Bolton on phases and steps, I kind of look at it like how mental health struggles their way through a biomedical organization to have the organization accept that there is no health without mental health. And then we came later and we are doing the same struggle to have people and biomedicals understand that you cannot work on an epidemic, for example, with just an epidemiological and a biomedical perspective. You do need, and it took like 3 Ebola appraisals. It took COVID to be almost there, but not yet quite there. And I will say that what actually pushed the acceptation of anthropology in MSF, in when MSF started to deal more systematically with issues that are not only biomedical. For example, sexual violence. Of course, there is a medical dimension with it, but you have all other elements. And the key element of it is how do you drive a woman in an extremely harsh situation to appear at the medical consultation within 72 hours. Is one of the key questions. For example, all the issues, all the projects where you're dealing with non-conventional forms of violence in Central America and Latin America, extremely complex. Everything that is chronic, help HIV makes sense to couples that are serodiscordant, for example. So it's every time that MSF was struggling against non-strictly biomedical issues that we kind of raised our point and finally got to sit at the table alongside with our other colleagues. But it's a never-ending struggle, and we still need to prove that we are not just drinking tea with the natives. We still need to prove that we are not only coming around and asking for questions, and we need to struggle not to be confounded with our methodologies. You know, social sciences, anthropology is not about doing qualitative studies. Sociologists do a lot of quantitative studies themselves, and it's not about methodology, and it's cutting it down to methodology is, as we know, a way of questioning the world and ways to understand the answers we are getting. So I think this was basically the process, and I found that if I may just jump in quickly in the question raised by Pedro Silva. Yes, the difference between research for humanitarianism and on humanitarianism, and how do we go from one to the other, and it does raise some quite steady technical issues. And you mentioned the policies of confidentiality, for example, and I will say that if I look at my experience, I don't know, Bev, I think you published more based on your MSF experience, but I think that I have 90% of my work unpublished with MSF. And most of the reasons are not only, you know, the legal issue of confidentiality, the fact that MSF owns the data, but most of the time, if you write, you may not help, and you can actually do harm. You know, for example, that study I made in Venezuela on exposure to violence and food security, if I publish the results, the MSF will be expelled from Venezuela. In many settings, we have informations that are quite strategic, and the survival of the projects and for the sake of the patients, we need to keep those informations. We cannot say, I'm just back now from the Mexican border with the US with a quantitative and qualitative study. I cannot share the results right now because we will have fact checkers from the conservative side, and they will harm our projects that are ongoing in Reynosa or Nuevo Laredo. So one of the main difficulty is not so much on the intellectual and technical side. How do we jump from doing applied anthropology in an MSF setting is to the extent to what the work we're producing can cause some prejudice. And I'll say that the more sensitive and the more thorough the work we conduct, the less we can talk about it. Thank you.
Thank you, Jean-Francois. Really interesting to get into the challenges of doing research within organizations and then publishing the results. So we've a few questions now. Richard's was the first, but which is great, and it would be nice to hear of others in the audience who, you know, might like to share their experience of applying training in anthropology to humanitarian action.
John, there is actually, I think, 2 more questions before Richard's, just to let you know. This wasn't the first. There's also Mark Anderson and yes. Rosie Reid. And there's also a raised hand, so it's up to you how we...
Okay, sorry. Let's take them in.
John, there's also a question, there are 2 people from Guinea. It'd be great to hear their first-hand experiences. I don't know how strong their internet connection is, but before they disappear, maybe we should bring them in.
Okay, yeah, let's go back to Ebola. if is it Kaisa Traore?
Yeah. And Arthur.
And Arthur.
Yes.
Great.
Good morning, good afternoon, everybody. Hello. Arthur just left, and he is my husband. He's the native English speaker. Me, I am from Guinea, and you will forgive my English.
No,
and
it's excellent.
Thank you, thank you. It's my first time, and I am from Guinea. I was born in Guinea, and I didn't live in Guinea since 1988, but I regularly return to Guinea, and I am from the city which called Gekedu, the southern of Guinea. This is the only city, the city which is having the border with Sierra Leone and Liberia. Basically, it's the center really of the outbreak of Ebola, and this is where I went to the school. And I grown up there in my village called Kasadu. Gekedu was seriously impacted by Ebola. And I was very, very shocked because 3 months before the Ebola outbreak, I was in Norway, in Stavanger. And then I had some health problem. I collapsed and they took me to the hospital. And when I arrived to the hospital, they immediately put me to the quarantine. And then I was surprised to know why I was in the quarantine. And in my Guinean passport, I had the visa from Saudi Arabia. I had a visa in my Guinean passport where they tell me that there was coronavirus there or something like that. And then I was domiciling in Malta. I was told that there is a SARS or something else there. And I was told that in Guinea that there was Ebola. And that was in January 2014. And then in March, I arrived to Guinea. And then I was in Guinea where I met by accident Mr. Bernard Kouchner on the beach in Guinea with his wife. And then very big coincidence. And then we were just speaking. And then a few days later, I traveled in my town, Gekedu, where I was announced that the Ebola outbreak has started right there. And therefore, I was really, really shocked because the people didn't believe. People didn't believe, my ethnic people, people didn't believe on it. They believed that it was an imagination from I'm sorry to be very direct, from the white people. And then they said that's not true. And then I said to them that they need to be careful. And I tried to explain to my family what to do and please to be careful, to stop moving too much. And because unfortunately, this region of Guinea, we eat we eat the meat of the monkey and all these other animals. And we have this river, which is just the border between us and Liberia and Sierra Leone. Therefore, we have this big market there every Wednesday where all the people from the 3 countries meet. And I remember clearly my cousin telling me that the price of the monkey was very cheap, that there were an abundance of the monkey meat there. And I don't know if that was connected really with that. And some people tell us that there were some people who doesn't eat this monkey meat because they are Muslim, they become Muslim, they are not eating, but the rest of us, we are still like a natural people. I was asked, do you still eat it? I said to my cousin, no, I don't eat it. I don't even remember ever eating that. And I tell them about the illness, zoonotic illness. I tell them that to be really careful that some illness can pass from the animal to the human. And I was told by my relative that we have been eating that for the centuries, nothing happened to us, And then shortly I my daughter called me from the UK, Mommy, return, get out of there. There is Ebola. You know, this is what I can tell you about my experience of Ebola.
Thank you, Kaisa.
Yes,
Thank
no
you. Just going back, that was my mistake. My screen wasn't fully opened up, so I missed some of the first two questions. If we could just go back to the one that Mark Anderson was presenting. So a question for either speaker: did you encounter any challenges around initially convincing other stakeholders about the value of contributing anthropological perspectives? And if so, how did you make the case, so to speak? And he's asking from his position as a lone anthropologist, as he calls it, in a STEM-focused institution. So I think that's, yeah, it's all about the challenges that you faced in convincing colleagues. So do you want to have a go with that, Beverly, first?
Yeah, I can. I mean, it's interesting, the term stakeholder. I think one of the elements of sort of doing anthropology inside MSF is the recognition that we are insiders and we sign up to, you know, the humanitarian endeavor in a sense. I think that some of the ways of showing the value of anthropology was by doing just that. It was less about trying to convince verbally of the value. It was more about getting involved and showing that what it could look like. At the same time, I would say as well, not just sort of enabling whatever health program implementation was of biggest priority or concern within that particular project, but also, you know, shining a light. We basically look at the same space differently. So shining lights on where, for example, I know Doris did some work in Afghanistan and the team were concerned that women were coming to the health centre in order to deliver their babies, and they weren't necessarily the women that MSF wanted to reach. MSF wanted to reach women that were likely to run into complications during childbirth. So MSF termed that as a safe birth. The women were coming to the health centre because they felt afraid to give birth in the village, because the village was often under attack. It was a conflict going on. So the women that went to the health centre also wanted a safe birth, but they wanted to feel safe giving birth. It wasn't necessarily associated with. So pointing out to the team that, you know, concept of safety, or how MSF saw safety, was quite problematic. So that critique element comes in right there. So, you know, showing and working together, getting into that dialogue I mentioned earlier, you know, the misconceptions about what anthropology is good for was profound when we were starting out. So I would say that talking about it is has its value, but actually, you know, demonstrating it was sort of made the difference.
Thank you. Really interesting. Melissa, how your experience, your institutional situation is different, but within this preeminent medical school, London School of Hygiene, Tropical Medicine. How was your experience in introducing and increasing the profile of anthropology?
Well, I think within the school, it's LSHTM, it's actually a very varied picture. And you couldn't really characterize it as a particular, colleagues have very different ideas of what anthropology is and how it might contribute. I think for some colleagues, their idea of anthropology is worrying. It's a little bit, not that much more than a CAP survey. And it's just like the cultural piece that is added in at the last minute to probably stamp a project that's going to continue anyway. But I do think that picture is changing, and it's changing quite fast. And it was certainly very evident during the Ebola outbreak, where very senior figures like our then director Peter Piot, who had a very different vision of what anthropology could do and how it might contribute. So, it's a vibrant space, LSHTM, and fosters many different kinds of anthropology, and they contribute in multiple ways. I think probably beyond LSHTM, it also depends where you're working and with whom you're working. In some contexts, maybe anthropology is a kind of, a legacy of it bears its past, seen as a sort of neo-colonial discipline that's there not to be trusted. And how do you kind of navigate that when you're trying to make really quite pragmatic contributions to policy and programs? But I think overall, I'm actually very positive about the space that anthropology is in at the moment. And there's an enormous willingness, I think, and recognition that there's no single discipline that actually has a kind of monopoly of knowledge and a monopoly of insight. And that the best way forward is to kind of find productive ways to work together across the biological and social sciences and within the social sciences. And consequently, it's actually quite dynamic, and there's lots of scope for anthropologists to make very useful contributions.
Great, thank you. I hope that answers your question, Mark. I just wonder whether you referred, Beverly, to your paper that you and colleagues prepared on what is anthropology good for, as being very helpful in beginning to change attitudes towards anthropology. I mean, I'm sure that's readily available online. I think I came across it the other day. If we move on to Rosie's question, Rosie was interested to hear Beverly talk about anthropologists working at the interface of critique and intervention. Could you say a bit more about what you mean by that and give some examples of conditions in which anthropological critique is more or less likely to be heard within humanitarian interventions?
Yeah, and I'll invite Jean-Francois as well to come in. I think it's very subtle. It's the subtlety of critique. It's in the Dutch section. We are now integrated as part of a multidisciplinary team. And I saw a question about psychiatrists and how we work. So, I mean, we work very closely with the psychosocial teams and have a lot in common, as Jeff's already indicated. There's overt difficult conversations where critique would come in. I think the para-analysis work that we're doing, all the way through that work, and even to the point when we will disseminate the work, we are trying to subvert expectations all the way through. And what that means is that, like any big organization, there are expectations about how things are done. How do you analyze things? How do you review them? How do you then report back? And we're trying to subvert that all the way, sort of drawing on that meta reflexivity that we have in MSF, which that's a phrase that I've stolen from Jean-Francois. That's how we can get inside the different sort of reflections and almost at sometimes existential nature of what goes on inside an organisation like MSF, and so it's very subtle. But once you, like also mentioned, you're at that table, and you know, on the sharp end, you're getting involved in really quite significant work, some of which, you know, has a direct impact, and other it sort of impacts over time. You can find yourself involved in influencing in many different ways, and, you know, applying the critique sort of almost, you know, it sort of proliferates. It can influence, you know, the big questions inside the organizations, as well as the sharper end, you know, day-to-day activities linked to, you know, working in uncertain crisis situations with populations in dire straits. So that's how I'd respond to that. JF, do you want to add to the critique element's really important, because that's where we manage to avoid complete co-optation. Yeah.
Yeah, Beverly, you said existential. I think that sometimes we are kind of a schizophrenical position, because what we meant in the book about the difficulty to deal with the classical critical position of the anthropologist is that if we are in just to criticize the premises, the geopolitical order, to practicize a disconstruction of the relation between knowledge and power, a la Michel Foucault, we can spend our life doing that, and some people rightfully spend their life doing that. But this is not what we do. One thing is reflecting on the global anthropological elements embedded in humanitarian action. What is humanity? What is suffering? What is the body? What is pain? What is whatever? Another thing is when you're in front, inside the situation, face to face with the people, and you are committed, and you committed yourself to provide some responses to local challenges, and to participate to the decision-making process. So, of course, you never forget about your epistemological apparatus as an anthropology, and you can't fail to observe when there are relations of powers involved, when or abuses of authority. For example, like it happened a lot during the Ebola responses, but you exercise your critique in a much more practical and cooperative way. It's not about saying no, but you think you're saying that, but you don't know how much, you know, like Donna Haraway does, showing how there is a bias in every single biomedical research that she can read, and she's probably right about that, but this is not what we're doing. And when we are committed to, for example, negotiate access to community for the construction of an Ebola treatment center, for example, and when we are asked to understand why wouldn't women come in South Africa to our clinics on sexual violence, and when we are asked why in Haiti medical doctors will deny the reality of dengue fever in the island, we're not here to get the big picture of anthropology talking about humanitarian situation. You need to come up with some concrete answers. So basically, the schizophrenic dimension is how you get in and out constantly, because you cannot lose your identity as an anthropologist, but you cannot lose either your practicality as an applied anthropologist in a concrete setting.
Okay, thanks, Jean-Francois. Melissa, did you want to come in there?
Yeah, I will do. Just to sort of flag how much work there is that needs to be done by anthropologists in that broad arena of mental health in humanitarian settings. Because my own observation from work in northern Uganda is that there's a way too much reliance on using kind of diagnostic categories like post-traumatic stress disorder and depression when looking at the impacts of forced displacement and social suffering linked to war and conflict and so on. And I suppose there's a sort of tendency to focus on the diagnostics at the expense of actually looking at local idioms of distress, the significance of engaging and responding to distress in that local context, and how that in turn is shaped by much broader, socioeconomic struggles which profoundly shape people's capacity to be able to move forward. And so that sort of broader picture, I think, in that terrain of mental health is really, really helpful. Yeah. Great.
Thank you, Melissa. Right, time to move on to Joanna Lee's question. Yes, she would like to ask both Melissa and Beverly that when you cope with humanitarian issues, do you have an anthropological model for analysing the issues and then make a plan for them? And then her supplementary question was also, she's curious if anthropology, the discipline itself, is helpful for building relationships with people from all levels or stakeholders, and then working towards solving humanitarian issues. So who'd like to start with those two questions from Joanna?
Beverly, do you want to go first?
Okay, yeah. I'll start with the model. I mean, you draw on I've drawn on my theoretical training, and I do use tools for research as well, and it depends on what it is we're looking at anyway, but drawing on those tools, whether that's thematic coding, or I know that Jean-Francois works more as well with quantitative surveys that also have a social, well, you can explain more about that, Jean-Francois, if you like. We sort of, we were looking at restricted context detention centres and how a survey tool was used. Well, when it was developed by our public health colleagues, there were parts of it that Jean helped, sort of socialise those questions, if you like. So we use, definitely with methodology, we are interested in diversifying that so that we can sort of understand or work closely with the phenomena or populations involved in the most optimum way. You mentioned relationships. I was talking yesterday that a very high percentage of success in medicine is about relationships. We were talking about that with the doctors and nurses here in Uzbekistan. Yeah, I think what I find in my work is that I'm constantly confronted with what is going on in relationships, the different dynamics that you find, that the different sort of around tuberculosis, for example, the informal support networks, what that looks like, how with a cure for a disease that has been poorly cured for over 50 years, finding a cure that has an 80% chance of working has led to confidence in that treatment, which has increased the it's confidence and relief that something works, which has increased the support that those informal networks are able to give, because previously they would feel there was an alienation element to having TB. And even though, of course, your informal network, you know, your family support you, there were parts of that cycle of 2-year treatment where, you know, you would not be bringing money into the home. It would cause arguments. Women with TB who were isolated from their children, you know, it would cause disruption and difficulty within a family unit. So it was harder to support. Whereas now, a shorter treatment that has a good chance of being successful, those support networks are thriving. So relationships, yeah, that would be something. I mean, it is part of what you do in anthropology, is to think about, you know, what the social setup is, what's happening, what the sort of power dynamics, politics within that. I would say for myself, it's just through experience and the sort of what you learn and what you know that contributes really to the way I work.
Thank you, Beverly. Right, Melissa, do you want to have a go at that question?
Sure. I mean, I guess I wouldn't call it a model, but probably my starting point when I undertake any piece of work would be the same, which would be to work in a very kind of open-ended, dynamic, iterative way, and to go from there, if you like. So maybe to start out with some broad issues or themes that look like they might be positive, you know, a good way forward, and then to revise those constantly and refine them and add more as one goes along. So building an analysis from the bottom up. But, and yes, related, the follow-on question relates to that, because yes, of course, anthropology can be hugely helpful in terms of building relationships, can facilitate discussions between those living and working at the most local of levels with those institutions and organizations working at a national level and even a global level and back again. So there's this sort of facilitating that sort of discussion is ultimately where one can be most helpful, because you can foreground those issues at that local level and refine policy sort of in real time and in such a way that can have positive impacts back on the ground. So it's not easy, but it can definitely be done. Yeah. Great,
thank you, Melissa. Right, yes, my apologies to Athena. Eskioglu. Because I've got various things open on the screen, I was missing your raised hand. So I think I'll ask you to unmute, and if you can ask your question. Thank you. Where are you from? And
I'll say something about myself. My name is Athena Eskioglu. You did say it correctly. I'm a forensic anthropologist, and I'm based in Greece. I used to be in England, and I've moved to Greece because I was the only forensic anthropologist who spoke Greek and could actually do work here. And what I wanted to say is, like, I felt like I could identify with all your journeys, because my journey has been a very lonely one as well. And coming to Greece, I've realized how many problems with understanding the spectrum of anthropology is, and how we can impact the social policies here. And I know it's European Union, and I know people don't think that Greece being in Europe won't have major problems, but we had much more. And seeing what was happening, my aim originally was that one person cannot, like, there's a Greek say, one cuckoo bird cannot bring the spring. Don't know if it makes any sense, but it means like one person cannot make a change. But what I did, I worked very hard, and I joined a registry for politicians for the political party which is on power right now, years ago, like when I first came. And I try to influence them in social policy in regards to holistic approach to health, how they approach like the mental health, promote children's health more. And my aim, because the Greek parliament, the way it works is that if you want to actually make changes, you have to have more than 50% power in parliament, which we managed to achieve. And then coronavirus came, which was a thing that I was keep telling everyone we should do something about, like mass disaster management, think about health, prepare yourself. I had a lot of knowledge, which I found that most people did not understand. I don't think people understand what anthropology is and how it can impact positively the communities, the laws and everything that's happening in everyday life, and how multidisciplinary collaboration within organizations should work. I found a lot of problems in regards to how people view anthropology here, especially with doctors. They were like, they fought me all the way. And they were like, no, we're humanitarians, you're not. And I was like, why? Why it has to be me or you, and we can all not work together? And during the coronavirus, I started an organization to help with because I understood the problems with like domestic violence and the lockdowns, what the impact would be. I was lucky being in that registry because all the laws and legislations which are brought forward to my government, they did happen and they did impact society very positively. And what I wanted to say today is that we need to have more people like you and more anthropologists into politics. We need to aim there, because I think that's where the real change comes.
So thank you, Athena. So just if I could summarize your point, you were a lonely anthropologist, but you've created your own networks.
I still am. I still am. Most people don't understand what I do. I'm like I'm more into a modern forensic anthropology, which people don't understand exactly what it is, which is more like a medical legal death investigator. But we do so much more. We take a holistic approach to mass disasters. We see other things. You know, it's like we see abuse and how and multidisciplinary collaboration into abuse can save victims and help people and bringing awareness. I think it's a very big issue into society. And I don't think we can achieve that being a lonely anthropologist if you don't go into politics, unfortunately.
Okay, thanks very much for your offering your perspective, Athena. Okay, we have very little time left. Well, okay, either we take one more question and try and fit that in, or we finish there. And I thought this last question, with apologies to others that I'm skipping over, but this question from Lizzie Hull, how do you deal with the heterogeneity of local experiences, especially contestations or competing interests arising from gender, class, age, inequalities, and so on? And how do you convey that complexity to policymakers in a way that allows interventions to be sensitive to those differences? I mean, that I think is really key question. And as I say, my apologies to the other questioners, but that struck me as a really pertinent question. Thank you, Lizzie. So who would like to take that first?
Beverly, I'm sure you've got lots of experience.
Yeah, I can follow it, but I want to bring Sean in, because I know got some very good examples of this related to gender. Otherwise, I can take it, Sean.
No, actually, well, the one difficulty to deal with differences is to accept for MSF to do vertical projects on specific people. So you target people based on their specificities, whether they have a specific affection or because they have a specific gender. Especially when we work with sexual violence, even we know that it also tackles men's reality. The truth is that the issue of differences is being tackled within the organization by major changes in its recruitment policies towards diversity, and in the way that we try to be self-aware of the power and the potential symbolic violence of the presence of MSF in a given context. But when we go down to differences based on gender, female genital cutting, for example, is a very specific gendered targeted problematic, or fistulas, or everything that goes around sexual and reproductive health, maternity. So, I mean, by the type of problematics that we choose, we already deal with differences, which does not mean that MSF as a global apparatus isn't exempt from critics on the way that it's still pretty Eurocentric and has a hard time dealing with the post-colonial debate, especially from a biomedical perspective, because they don't understand how the development of a drug for neglected disease, for example, like MSF has built this GNGA lab on the money price for the Peace Nobel Prize from 2009. So basically, what I'm saying is that we're in a complex web where we are doing, as an organization, choices of specific populations to target. Like when we target migrants, for example, when we target people affected with specific difficulties, we leave aside people that we don't live with their difficulties. I was just in Severodonetsk in Ukraine, in the Donbass area, just at the moment of the war. And at that time, we were dealing only with HIV people and that were injectable drug users. So it can be very specific within a context that was blatantly needed for a better or a larger perspective from an MSF approach. So yes, that's basically it. Gender and differences are tackled by the difficulties, the medical problematics that we choose to deal with, but it's insufficiently tackled within MSF as an organization. I don't know if you agree with that, Beth.
Yeah, I mean, I'd add that the work that in Tajikistan around domestic violence and TB, and I think of other work that building trust with the family groups themselves or other sort of elements of influence as far as policy is concerned. We've got a long-term relationship, for example, with influential people within the Ministry of Health here, but also within the social protection sort of sub-department in the Ministry of Health, which is evolving, it's, and so having those trusting relationships and being able to talk openly about difficult, sort of sensitive areas is what we do also, knowing that often sort of in the more remote parts of the setting that we're working, we would be working closely sort of within the household, knowing that within the household and then in the broader community, you've got lots of different tensions and influences going on, but building that trust and trying to understand that and trying to choose, you know, when you have those conversations and how you have those conversations would be how we address, you know, the sensitivity often that comes through linked to inequities. We also see in Penang, with the Rohingya population there, there's you know, levels of dehumanization, structural violence, but we also revealed, excuse me, even within the Rohingya population, some complex forms of oppression that happen within. So trying to tackle that is linked to the trusting relations that we develop. Sorry.
Time for some water, I think, Beverly. Okay, many thanks. I'm afraid, everyone, we have to move on. So I'll draw the questions and answer session to an end, and I'll now move to Raymond to provide a sort of summing up of our discussion so far and picking out any issues that he'd particularly like to raise. So for those of you that don't know Raymond, I'm sure he's well known to many of you, but I was just going through his CV last night, and yes, I mean his you know, his okay, he doesn't like this, but I'll just say, you know, professor of sociology at Makerere in the 60s, development studies and change, East Anglia in the 70s, Canberra. Yeah.
Well, that's very kind of you, but yeah.
No, okay, I'll stop there, Raymond, and I'll hand over, and we'll make utilize the time better, I'm sure. Okay, over to you.
Thank you very much. I'm even would have preferred to hear more questions and more answers than to try to sum up, but I will try to sum up because it might help a little bit to move things on a little bit. But it's very difficult, and I'm not going to pretend to be, I don't think I can do this very well now. I could try later to come up with a little note, which might be more helpful. But I tried to make a few remarks, 3 sets of remarks in 3 different aspects. Firstly, just by way of introduction, I think what came over very strongly is that particularly recently, anthropology has been welcomed into international humanitarian studies. And if you'll forgive the little joke, not only by the Wellcome Foundation, although the Wellcome Foundation was clearly a very important player. And if one compares anthropology in international humanitarian studies now with anthropology in international development studies, it's quite different. The history is quite different. And even if in humanitarian studies, one is wondering what is an anthropologist and what is an anthropology. In international development studies, it was quite easy. An anthropologist was a non-economist, full stop. That was all that mattered. So if you draw the distinction, despite the difficulties that have come up in the discussion about making a fuller use of anthropology where it could be useful, it's tremendous already compared with other praxeologies, compared with development studies in particular. And although for anthropology in development studies, there is a survey, which was pretty good, it's a few years old now, it was by an anthropologist, David Moss. There isn't yet a survey of anthropology in international humanitarian studies. And maybe somebody listening and joining in this evening or this morning where you are, it's night where I am, and probably where Beverly is. it's now, I think, the time it's a good time to try to do that. But what came up very strongly, I think, was how difficult that is going to be because of what anthropology is or isn't. And we've often, it came up earlier in the discussion that it's really not clear what it is. But then later in the discussion, it came up that nevertheless, Olivia and others are teaching anthropological methods. So between what is impossible and what is possible, something might be going on about where the human could be factored in, to quote, to remember the quotation words that were used. But I'm still puzzled, and I still think it's a huge challenge. I would love to know what these techniques, tools that Olivia mentioned that are being taught. I'd love to know what they are. Because where anthropology, this is my take on anthropology, where it's at a disadvantage for application and broader use in this way is there are no ICs. There are no anthropologists that we can transmit or teach or learn very easily. There's economics, there's politics, there's demographics, but there are no anthropologists. And this ICs missing element, until that's addressed, I think it would be quite difficult to go a bit further and to see, and we have to see what is being taught nevertheless, even without the ICs. There's ethnographics, but about ethnographics, as we may have time to come on to in a moment, there are many problems. Anyway, that was my introduction, but despite the present situation, which is mixed, compared with international development studies, it's very rosy. Anthropology is having a wonderful time in humanitarian studies by comparison. Oh, I've been making all these notes. I can't really read them, but I'll try my best. Now, I thought three themes did come up quite strongly, particularly the first theme. And it came up right at the beginning and went all the way through, namely what anthropology could or couldn't provide. I'm going to put it in this way: at the delivery point or the contact zone where the international humanitarian work meets the local community. And it came up when Melissa was talking about burial customs and home care. There's that kind of point of delivery where there are lots of anthropological questions to be asked, which are being asked. And what came over very strongly is, in that regard, the answers that anthropology, here because it's particularly the ethnographic side of anthropology, are coming up with, seem to have been welcomed. I mean, that seems to be a bit of a success story. And Beverly, and many of the questions and the contributors that came up from contributions from the questioners were about that. So that is, I think, one theme came over strongly. A second theme which was mentioned but didn't come over as strongly as perhaps it might have done, the role of anthropology when it comes to evaluating the actual track record of international humanitarian intervention and action. Where that did come up was with regard to the affected populations. Sorry, is that my machine behaving strangely, or me?
No, it's all good. I think somebody else unmuted, but it's fine now.
Oh, am I properly unmuted and so on?
No, yes. You are fine.
You're fine.
Okay.
Perfect.
Okay. So a second area which came up a bit, but not very much, was what anthropology could offer when it comes to evaluating actual track records of international humanitarian intervention and action. And of course, where it has come up and must come up, and obviously anthropology is very suited to help this coming up, is where you take a bottom-up view or a view from the village and you identify to an extent with the affected population and come up with their side of the picture. The operation of intervention might have been successful, but if the patient died as a result, from the point of view of the affected populations, how could that be considered to have been a successful intervention? And when anthropology was coming forward in humanitarian studies, you remember, if you go back to the 80s, the 1970s and the 80s, it was not very popular. The contributions that came from Alex de Waal in famine crimes were not welcomed by the humanitarian aid workers, organizations and agencies. And neither was the concept of double jeopardy, where somebody might be a victim of a disaster, but also a victim of aid, that came out from Barbara Harriman's work. So although anthropology was very prominent in humanitarian studies, international humanitarian studies from the beginning, it wasn't welcomed so widely then as it has become since. I thought that might be worth just throwing in. And another theme that did come up that was very interesting and very anthropological was where the situation of a biomedical situation isn't biomedical only, but something more holistic, some broader, some wider picture was needed, then that was what you could look to anthropology to provide. Because when anthropology does provide that, you're often considered to be a crazy anthropologist or a neo-colonial anthropologist, or somebody who really isn't sufficiently identified with the actual operation. So, and there's also a populism, which has often been discussed in anthropology, about ethnography and anthropology. And I don't know how you feel, but populism is very often not very helpful to anybody, politicians, people, or anthropologists. So there's an area there which hasn't yet been worked through, but it's being worked through gradually, perhaps, let's hope. And then finally, I've got a good clock here. I'm just trying to keep two themes I think didn't come up, which surprised me, or they came up in a very, very limited way, and particularly towards the end. And these two themes that I thought were largely missing, unfortunately, the practice discourse of the international humanitarian actors, because their self-image is of people who do things, who are involved in acting, in practice. And the practice discourse talks about trust that's supposed to be established, the dignity of people supposed to be observed, the partnership that people work through. Now, when anthropologists address those issues, they see these not as commodities or points of reference, but as processes, which couldn't possibly happen except over time and under certain conditions. And those are not the certain conditions of disasters, whether they're natural or human, and whether they're in conflict zones or not. I thought there might be some discussion about that. It began to come up when, from MSF, there was a point about the confidentiality of data. That was very interesting on the side of ethics. It was beginning to come up, and what was coming up there, you could reinterpret that and reapply that to rather silly remarks about trust, dignity, and partnership, as if these can just happen overnight. And they must happen, because without that, an agency can't claim to have been successful. Well, they can't happen. They don't happen overnight, and that is where there's a big conflict between anthropology, which is concerned with processes and changes over time. And in disasters and emergencies, there's never enough time anyway. So that's an area where I thought might come up, but didn't. And only at the end, finally, the bigger picture, the more philosophical and ideological picture of what is compassion, particularly compassion as pity, what is suffering. And jolly old MSF fortunately brought that up right at the end. So this isn't totally neglected. But there wasn't much of it. There wasn't, I thought, enough of it. The bigger picture, except coming up from one agency in one way, was I think rather neglected, or wasn't enough time, or didn't come up enough. And I thought that was a little bit disappointing. That's all, folks. I'm trying to limit the time.
Raymond.
And apologize for the brevity. I can come up with a little bit of writing later on if you like.
Raymond, I'm so glad this is being recorded, because that was wonderful, and wonderful to have it captured. Thank you so much.
That's very kind of you to say. I have a feeling I didn't capture the richness that we've been listening to, but I tried.
It feels as though we could carry on, and we would benefit from carrying on. Perhaps there's justification for round 2 of this at some point in the future. But just to allow our 2 panelists a final reflection, did either of you have anything to add, having heard Raymond's summary?
It's not a summary.
Well, it was observations.
Okay, thank you. Yeah,
observations.
Observations. Thank you. Yeah.
I mean, am I on mute? No.
No, you're fine.
Just ever so quickly, yes, I mean, I suppose I just agree with much of what Raymond has actually said. I think anthropology is in a very good space and has demonstrated all sorts of ways in which we can contribute and enhance the work of humanitarian organisations. The door is open, and we just need to push it a bit more so that we're routinely and systematically at the table rather than sometimes at the table. But I do think, Raymond, your issue around the legacies of humanitarian assistance is really important, because humanitarian organisations by their nature work in crises, and once that is defined as being over, they're off, and then what happens afterwards is a really big issue.
Yes.
And I suppose MSF in this respect is probably the exception, in the sense that they are much, much more open-minded to hearing about the problems of their work and how best they might improve their work in a way that's much less evident with other humanitarian agencies. Evidence partly in that book, but I mean, I can give you 101 other examples too.
Absolutely.
So, yeah, hats off to MSF for leading the charge, really.
Oh, and anybody teaching international humanitarianism depends heavily on MSF for these bigger picture issues. And they came up beautifully today, including the points about post-traumatic categories, and not less didactics and more idioms of distress, your own points. I mean, these are absolutely very important, which I didn't comment on, forgive me. Yeah.
Beverly, do you want to add anything? You're on mute.
Okay. Yeah. Am I on mute?
That's it. You're fine now.
Am I okay now? Sorry.
Yeah.
Sometimes that happens, doesn't it? When the universe does not want me to speak. Okay. No, Raymond, thank you so much. David Moss taught me, and a long time ago, and Barbara Harrell Bond was a big inspiration for me studying anthropology. So yeah, I think we would like to take up the offer of looking at the role of anthropology. I completely agree with you. Evaluating, its record in humanitarian situations. And secondly, the point about, you made a point which I agree with about process, under certain conditions, and it takes time. And one question I sent to you, John, as well, but also that was raised in the book, is about the existence of humankind at the moment and the transformation, because that really is where MSF is working. We are working with political transformation, you know, the consequences of political transformation and the state of our ecology. In Khaukar, Pakistan, where I have just been, there isn't any water, and you know, it's in that sort of context that I would sort of argue, even in those uncertain, quite dramatic circumstances, there is time. We do take the time, and we should take the time to process properly. I guess I'm talking about the future of humankind in the next, you know, numbers of years, where our children and our children's children will be grappling with all sorts of issues around inequities and crisis. But I think, I don't know if John's still online as well, the time needed, I think we do have time in the settings we work. It just gets, it's the pace, and it's coming, the sort of way we do ethnography is that we start and we go back. It's quite dynamic. It's so, we do have examples of longer times that anthropologists spend. Vanya Kovacic just wrote a book about recovery of Syrian combatants that are dealing with reconstructive surgery, and civilians that are dealing with reconstructive surgery. But then other examples would be that it would be a way more dynamic ethnographic view of being there and then leaving and then going back, which is an experience. I'm sure, Melissa, that's been your experience as well, of returning. The return is important, isn't it? But we will absorb that point about processes and time in uncertain circumstances. And we would love to discuss that again more broadly. Thanks.
Thank you, Beverly. I'm afraid we've run over time, and we'll have to bring it to an end. But I'd just like to close by thanking our two panelists, Melissa and Beverly, and for Raymond for offering his perspectives, and to Haneen for managing this so well. So really grateful to you all. It's been my pleasure. So thank you, everyone. Take care. Have a good day. Bye.
Bye.
Thanks
Bye.
very much, John, for sharing.
No,
Thank you.
Yes.
my pleasure, honestly. Thank
He
you.
says he's retired.
You look very well on it.
Semi-retired.
Thank you, everybody.
Take care, everyone.
Thank you to John, Raymond, Melissa, and Beverly, and thank you to everybody in the audience. I'm going to take off the spotlights now, so anybody who's still there can see each other and wave goodbye. So wonderful to have you all. Have a good rest of your day, of your evening, or of your morning. It was a pleasure.
Thank you. Thank you, Haneen.
I'm going to close the event now.
Thank you, everyone.
Bye.
Bye.
Bye.